Please give a warm Farm Bureau welcome to the Governor of Kentucky, Governor Steve Beshear.
Thank you. Thank you all very much. I want to start out by asking the three people that Mark didn't introduce to stand up. Actually, Mark, I'm just glad you introduced the First Lady because I was going to really be in trouble if you didn't do that. I do want to take a minute and just say thank you. Thank you to the farm community, farm families in this state for what you do, for the partnership that we have had the last 5.5 years. And I want to particularly thank and ask you to show your appreciation right now to Mark Haney and his team at Farm Bureau for everything they do for agriculture. Mark, thank you. You know, the world has changed drastically over the 50 years that the Kentucky Farm Bureau has been sponsoring this ham breakfast. But one thing hasn't changed. Kentucky's farmers and Kentucky's farm families remain the heart and soul of the Kentucky economy. The numbers speak for themselves. Total economic impact, $46.3 billion. Cash receipts hovering around $5 billion, and some 263,000 jobs attributed to farming in this state. Everybody who's ever tilled a field or raked hay or mucked out a barn deserves a pat on the back because those numbers represent sweat and labor. But I'm also thankful, as I just said, to the people who spend long hours in the office and on the phone advocating for farm families and building partnerships. The Kentucky Farm Bureau, the Governor's Office of Agriculture Policy. I'd like to ask our man over here, Roger Thomas, to stand up, and let's give him a round of applause for what he does for agriculture. The Department of Agriculture, the Agricultural Development Board, the State Cabinet for Economic Development, as well as our many county-level officials. As some of you know, Jane and I own a small farm ourselves, and having advisors like Roger Thomas, whose livelihood and love are intertwined with life on the farm. So we know the importance of working together to expand markets for our farm families, to foster agricultural entrepreneurship and agribusiness development, and to develop our rural farm economies. That will continue to be our priority in the year ahead. So will be protecting the Agricultural Development Fund and the projects it makes possible. Projects like creating alternative crops and enhancing and developing our water supply. You know, in this ever-evolving world, our farm families need people in powerful places to stand up for them. That's why I'm frustrated, and I think you're frustrated by the political shenanigans going on in Washington, D.C. One reason I say that is our farm bill. This is one of the most important pieces of legislation for rural Kentucky that comes out of our nation's capital. It's a critical safety net for farmers whose livelihoods are often jeopardized by forces beyond their control. You use it for planning. You use it for security. The Farm Bill is also the primary agricultural and food policy tool for this nation, so its value transcends the farm economy. Yet this bill remains tied up amid a partisan political battle over, among other things, whether we should continue to help feed the poor. The current version of the Farm Bill expires September the 30th, just a little over a month away. And Congress doesn't even come back into session for a couple of more weeks. Our farm families are waiting anxiously to see what happens, and they deserve reassurance. So I'm calling on all of our congressional delegation and everybody in Washington, D.C. on both sides of the aisle to get off of this political bickering and let's pass a farm bill that will support this nation's farm families. Now, just as every farmer needs the safety net provided by crop insurance, every farm family also needs affordable and accessible health insurance. Some 640,000 Kentuckians lack health coverage, and that 640,000 includes many farmers, either because it's not available to them or they can't afford it. Folks, that's 15% of our population here in Kentucky. Trust me, you know many of those 640,000 people. You're friends with them. You're probably related to them. Some may be your sons and daughters. You go to church with them, shop with them, help them harvest their fields, and sit in the stands with them as you watch your kids play football or basketball or ride a horse in competition. Heck, you may even be one of them. It's no fun, folks, rolling the dice and just hoping and praying that you don't get sick. It's no fun having to choose between food and medicine. It's no fun putting off a doctor's appointment hoping a condition turns out to be nothing. In fact, it's downright dangerous, and it's harmful to one's financial and physical health. It also has a significant detrimental impact on this state's economy and our long-term capacity. Kentucky's collective health, folks, is among the worst in the nation. We rank, we like ranking first in basketball and different things like that. Well, here are some things that we don't want to be first in. But unfortunately, we're either first or right up there in numerous categories. Everything from preventable hospitalizations to cancer deaths, to premature deaths, to cardiac heart disease, to diabetes. This has jacked up our healthcare cost and has affected worker productivity. It affects our quality of life. It affects our school attendance. It affects the state's image. And look, these rankings just didn't happen this week. Ever since they've been having these rankings for years and years, we really haven't changed all that much. We've ranked that bad for a long, long time. It sort of reminds me of that old definition of insanity. Keep doing what you're doing over and over again, and you expect a different result. Well, we're going to do something different, and we're going to change the course of Kentucky's history. Because the Affordable Care Act is our historic opportunity to address this weakness and to change the course of the future of the Commonwealth. Through it, we're going to make insurance available for the very first time in our history to every single citizen of the Commonwealth of Kentucky. Now, some 308,000 of Kentucky's uninsured, mostly the working poor, will be covered when we expand the Medicaid program. The other 332,000 uninsured Kentuckians can access coverage come January 1 through the Health Benefit Exchange, the online insurance marketplace. Kentucky is on the leading edge of this effort because we know how badly our Kentucky families need health care. We also know what a good deal this is. I made this decision for two reasons. Number one, it is the right thing and the moral thing to do. But that's not the only basis for this decision. Because if we can't afford to do it, then we have to try something else. So I didn't make up numbers myself. I asked two independent groups, the University of Louisville Urban Institute, PricewaterhouseCoopers, the internationally acclaimed accounting firm and actuarial firm, and they did a study for me. And they came back in about 6 months and said, Governor, quite honestly, you can't afford not to expand Medicaid because it's going to inject about $15.6 billion into your economy here in Kentucky over the next 8 years. It's going to create almost 17,000 new jobs for Kentuckians. And it's going to help your state budget in a positive way over that 8 years by about $802 million. And yet the critics continue to ignore those facts and are still trying to kill or delay this program. It's amazing to me how the people who are pouring time and money and energy into trying to repeal the Affordable Care Act sure haven't put that kind of energy into trying to improve the health of Kentuckians. And think of the decades that they have had to make some kind of difference. Look, the same fears, the same arguments that the critics are using today against the Affordable Care Act were the same ones trotted out in 1935 when we adopted Social Security. The same arguments they trotted out in 1965 when we adopted Medicare. And look at the good those programs do today. The Affordable Care Act is going to work in Kentucky. Now, why do I say that? I know that because it's already worked in Massachusetts. Several years ago, then Governor Mitt Romney took this same plan and put it into effect in Massachusetts. It has the mandates in it. We didn't see businesses leaving in droves or anything. It works there. And people have coverage, and they have good health insurance. It is going to work here. It's time our leaders, all of our leaders at the local, state, and national levels, put aside these time-worn political posturings that we're doing all the time and start working for the people. When I think of Kentucky, I don't see people with an R or a D or an I after their name. I see the farmer driving the tractor to the barn long after dark. I see the teacher staying up late grading papers. I see the Kentucky National Guard soldier saying goodbye to her family. I see the preacher in the pulpit. I see the truck driver. I see the small business owner. These people need our help, not our political excuses and not our political posturing. So, ladies and gentlemen, let's get to work, all of us together, because if we do this together, we will make Kentucky such a great place to call home. Thank you.